Hello and welcome to this week's episode of Makosi Today. Well, we've actually interrupted the pattern because of what's happening in the world. With coronavirus, we've been told to wash our hands, we've been told to isolate ourselves, but I thought we'll get a physician in the building to talk further about how coronavirus affects us as a continent. Today, I have Dr Adaeze Odili Oreh. Welcome to Makosi Today.
Thank you so much for having me.
So we've been told that we should wash our hands, we've been told about social distancing, but is Africa ready?
So I would say that there's an opportunity for Africa because we've seen how over the past couple of months, where cases have been increasing very rapidly in increasing numbers in the West, from Asia to Europe and the Americas. Over this time, the cases that have been introduced to Africa have been increasing more slowly. So where we are now is that we have less than 300 cases across the entire continent. Right. So where you're looking at tens of thousands of cases, in fact, over 100,000 cases worldwide, we have less than 300 cases in Africa, knowing the population that we have on the continent. Right. So that's an opportunity for us to learn, to observe what's happened in Asia, observe what's happening in Europe, and take those lessons to better prepare ourselves for what may not come, right, but what still may come. Right. So let's prepare ourselves in terms of seeing how we can slow the spread of the new coronavirus infection from person to person here in Africa.
What's your take on herd immunity?
My take on herd immunity is that, this is a virus that was just notified to the World Health Organization in December 2019. So give or take about 3 months plus. It's still too early for us to talk about herd immunity for these reasons. One, we don't know that infection with the new coronavirus and coming down with COVID-19 immunizes one against a subsequent infection. We don't know that yet because it's still a new virus that's being studied in terms of the life cycle of the virus and how it interacts with the human body. Right. So it's still a bit early for us to know that. And then vaccine trials are also underway. Right. So the first human trials for the vaccine should be taking place over the next couple of weeks. And one good thing that came out of Asia was that they were able to sequence the genetic material of the virus, right, and open it up to the world for researchers to start studying. And so we have more than 35 research groups that are actively researching and racing to the finish line of a possible vaccine and possible treatment for COVID-19. So those human trials for vaccines are currently taking place. And when we don't see a vaccine being ready, given the strict procedures for a vaccine that will be effective and safe before the end of the year. So we can't really talk about herd immunity as at now.
So should we be afraid?
I think we should look at fear not as completely negative, right, but we should look at fear as if we're afraid and that fear brings about positive action, then that's good. Okay. So in terms of fear, I think we should be afraid, but we should be afraid such that we then prepare.
Do something about it.
Yes, we change our behaviors to prevent infection on an individual and a family community basis. And then we also try and strengthen our systems to be able to take in any shocks that may come, right, or that may not come. Right. But then let's look at fear more positively, and fear that can spur us into action to prepare the continent to better react if we suddenly see an upsurge of infections with new coronavirus.
So how would you suggest we boost our immune system?
Boosting our immune system, common things.
Right.
Eating healthy, exercise, water. I know there was this, one of the myths that was circulating was with the new coronavirus, there was this message that people should drink water 15 times a day, every 15 minutes, and it would wash away the coronavirus. And of course, that's false. Mm-hmm. But drinking water, yes, at least stay hydrated, drink about 2 liters of water a day, mm-hmm. and a balanced meal with fruits and vegetables. Keep your junk food to the minimum. Right. So eat healthy, mm-hmm. factor in exercise. These are the things that are tried and tested.
These are the things we should live our life. Wash our hands every time.
Yes, these are lifestyle things right. that we should incorporate into the way we live our lives on the daily. And those are the things that will build up our immunity. And another important thing is what we've seen from the way the infection and the illnesses that have arisen across Asia and now in Europe is that the death rates are minimal. Right. The severe and the critical cases are a proportion of the total numbers infected. Right. But why it's important that everyone gets into trying to prevent the infection spreading is because we're healthy adults, we're healthy individuals, may still be able to transmit that infection even without any symptoms. Mm-hmm. You may be infecting someone who is elderly, someone who has another health condition that may have reduced their immunity or has affected their heart or their lungs, and then infecting that person exposes them to a severe or critical COVID-19 illness.
Right, okay, I get what you mean.
Yes.
So now with people like Jack Ma donating 500,000 testing equipment, I think, to America, if America has become a charity case, do you think Africa has capacity from where we are now? Do we have capacity to test? Do we have capacity to treat if need be?
So one good thing that happened with observing what was happening in Asia was that in a lot of African countries, they've been trying to strengthen testing capacity. Right. So whereas at the beginning of January, there were only 2 testing centers across the continent, now there are about 33 testing centers. Yes. So 33 countries have testing facilities. Wow. So this is not 33 testing centers. 33 countries on the continent have the capability to test for the new coronavirus. So which is a leap from January, when, considering this as of January 2019, this wasn't something anybody was dealing with. Right. So I think there's an opportunity for Africa to forge partnerships, work closely with the World Health Organization to get test kits. And also, this is where the manufacturing and research capacities of certain countries has come into the fore. South Korea, they were able to develop their own testing capabilities in country in under 3 weeks. And this was a collaboration between the private sector, the public sector, the academia. Everybody came together to make sure that they got this out. And that's why, if you look at the statistics, South Korea has tested more people by population than any other country in the world for new coronavirus. Wow. So these are some of the opportunities that exist for us to leverage on possible partnerships to make sure that our testing capabilities increase so that even asymptomatic people can have access to testing.
So at the moment, should we close borders and schools?
At the moment, and at the rate with which our infection rates are, not necessarily. Perhaps in South Africa, where there's more active spread in the communities, it's something that could be looked at. And so such a decision will be based on the context. Right. So for majority of the countries in Africa, the spread is slower. So what we should be doing is try to limit the spread in terms of advising people to keep public gatherings to the minimum. Right. Now that we don't have that active, because it just has to happen overnight. Right. And then everybody is now in reaction mode. So it's now to keep public activities to the minimum and where they're quite essential, so that people are not shocked when one day you say we're closing schools or we're closing borders just to limit the spread. But as at now, it's more important that people are taking lifestyle choices on board, regular hand washing with water and soap. If you have to blow your nose, blow it into a tissue, immediately throw it away, wash your hands again, and then cleanliness of surfaces, doorknobs, handrails in the home, and all that. Because it's more important that we are able to reduce the rate of infection from one person to another. And I'm sure in the news you've been hearing about flattening the curve. So in public health, when there's an infection like this and it's increasing to the point where a lot of new cases are suddenly coming up, it looks like a mountain peak. So what flattening the curve is doing is you're trying to flatten that peak to the point where cases, when they do increase, are increasing slowly, so that at no point in time do they overwhelm the health system. Because when you have that mountain curve, you now have, say you have a health facility that has the capacity to take in 100 people, and you have 50 spaces. So imagine 50 people coming in a day. So already day one, that health system is shut down. So any other cases that are coming in will be piling up with nowhere to go. So that's why it's important that we take prevention and preventive measures now when we have a slow increase, so that we are prepared, and at no time will the increase in cases overwhelm our already fragile health systems.
So I know you're overwhelmed as a practitioner, but if people want to get in touch with you, is it okay for us to give them your email address? If they have questions.
If they have questions, I am on Twitter.
Right, okay.
With my name and my Adaeze_Oreh. So any questions can
come to Twitter.
Yes. Yes.
Thank you so much for coming on Makosi today.
Thank you so much.
We're so blessed that you came to grace us. I know you're busy, so thank you so much for coming.
Thank you for having me on Makosi today.
So I hope that was a very informative session with Dr. Adaeze Odili Oreh. We'll put her Twitter in the link below if you want to ask her any questions, and if you want to ask her anything about these centers that she just spoke about, if you want to go and get tested. But I think what I got from her, if I was paying attention, was wash your hands, social distancing.
Social distancing.
Social distancing is a huge-ish thing, but she doesn't think we have to close our borders yet, and she doesn't think schools have to close yet, but she does think we should be aware that this thing could come and we should be ready for it. Until next time, take care of yourself and take care of each other.